Welcome back, you beautiful woman. My name is Dr. Lia Parker. I'm a certified OB-GYN, which is short for obstetrician and gynecologist, and for more than a decade, I was also an intimate health psychologist. Today we're talking about a subject I take very seriously, the 5 things I want you to keep out of your vagina. These are not just casual suggestions. Over the years I've seen far too many women, including women in their 60s, 70s, and beyond, experience real discomfort, infections, and sometimes serious complications from products or home remedies that seemed harmless at first glance. Before we begin, if you haven't already subscribed, I'd love for you to do so and turn on the notification bell so you never miss a conversation like this. This channel is a safe, judgment-free space where we talk openly about women's health, especially the intimate topics that too often go unspoken in our generation. Now, before we dive into the list, I want to say something important. I know that for many of us, growing up, vaginal health wasn't something we discussed openly. It was private, almost secret, and because of that, we sometimes learned information from friends, neighbors, or advertisements that sounded helpful but had no medical basis at all. Those tips can stick with us for decades, passed along without anyone stopping to ask, is this really safe? That's why I'm making this video. My role as your doctor, whether we've met in person or you're watching from your living room, is to give you information that's evidence-based, medically sound, and respectful of the dignity you deserve. I want you to understand why each of these 5 things should be avoided, so you can make confident choices for your body. One of my patients, Mary, who is 62 and volunteers at her church, recently told me she had tried one of these so-called natural cleansing products after reading about it online. It promised to remove toxins and restore balance. Within 2 days, she was in pain, with unusual discharge and a low fever. She felt embarrassed, but she came to see me. What happened to her is exactly why I want to talk about this today. So let's get started. I'll walk you through each item, explaining what it is, why some women use it, the risks it carries, and the safer alternatives you can rely on. Let's begin with the first, one of the most persistent and misleading products still on store shelves today. The first item I want to talk about is something that has been around for decades, and I wish it had disappeared a long time ago: douches. These products are still being sold in the so-called feminine hygiene aisle of many stores, often packaged in soft colors and with gentle-sounding names. They promise to cleanse the vagina, restore balance, and leave you feeling fresh. But as an OB-GYN, I can tell you with complete certainty, none of those claims are true. Douching means flushing liquid into the vagina using a bottle or other device. The liquid may be plain water, water mixed with vinegar, or sometimes a scented chemical solution. Decades ago, many women were taught this was part of normal hygiene, almost like brushing your teeth or washing your hair. Unfortunately, marketing played a big role in that belief, convincing women that their natural scent or discharge was something to be fixed. For women in our generation, those messages were especially strong. You may remember the advertisements in women's magazines or on television, telling us we needed to smell like spring flowers in order to be clean. That was never true, and it was never fair. Here's the medical reality. Your vagina is designed to clean itself. The tissues inside are lined with delicate mucosa and healthy bacteria, especially a group called lactobacilli. These good bacteria help maintain the vagina's natural acidity, which in turn keeps harmful bacteria and yeast from overgrowing. When you douche, you wash away those protective bacteria and alter the pH, the natural acidity of the vagina. This disruption can quickly lead to irritation, bacterial vaginosis, or yeast infections. In some cases, douching can even push harmful bacteria higher into the reproductive tract, increasing the risk of pelvic inflammatory disease. And for women past menopause, the vaginal tissue is often thinner and more sensitive due to lower estrogen levels, which means douching can cause even more irritation and small injuries. I often think of the vagina like a self-cleaning oven. It may sound like an odd comparison, but it's quite accurate. The body is constantly producing just the right amount of natural discharge to flush out old cells and maintain balance. When you interfere with that system, you don't make it cleaner, you create the perfect environment for problems to start. If you've been in the habit of douching for years, I know it can be hard to change. It may even feel uncomfortable to stop at first, because your body will be adjusting to its natural rhythm. But over time you'll likely find your comfort improves, irritation decreases and infections become less frequent. So if you have a box of douches in your bathroom, I recommend gently but firmly saying goodbye to them. Your body doesn't need them, and in fact it will be healthier without them. Now with that foundation laid, let's move on to the second thing I want you to keep far away from your vagina, a so-called herbal remedy that is far more harmful than helpful. Let's move gently to the second item you should never place in your vagina, what are often called yoni pearls. These small herbal balls, sometimes wrapped in netting, come with claims that they detoxify the uterus, cleanse the vagina, and even treat infertility. It's understandable why such promises might appeal, especially if you're seeking natural ways to support your health. But comfort me as I share what real medical scrutiny tells us. To date, there are no reputable clinical studies that support any health benefits from intravaginal yoni pearl. That means no randomized trials and no peer-reviewed data. Worse, clinicians and regulatory authorities like the United States Food and Drug Administration have issued warnings about claims made by sellers, pointing out that there's no proof of safety or effectiveness, and expressing concern about potential injury. In short, there's no good evidence that yoni pearls do anything beneficial, and there's reason to believe they could cause serious irritation or infection. Now let's turn to the third item, natural sea sponges used as menstrual products. These are often marketed as eco-friendly alternatives to tampons. In 1982, a research team cultured bacteria from the vaginas of women using different menstrual products including sea sponge. Their findings were telling. Users of sea sponges showed significantly higher colonization with Staphylococcus aureus, Escherichia coli, and other Enterobacteriaceae than tampon users did. And it gets more concerning. Around the same time, the FDA had samples of menstrual sea sponges analyzed in a lab, and found sand, grit, mold, yeast, bacteria, and at least one sample even contained Staphylococcus aureus. These findings aren't small or anecdotal. They speak directly to hygiene risks and potential for serious infections, including toxic shock syndrome. So even though sea sponges may feel natural, they are neither safe nor sanitary for intravaginal use. Now as we move along, I want to talk about something that might surprise you: garlic. Yes, the same garlic you might use in your kitchen for soups, sauces, or roasted vegetable. Over the years, I've had more than a few women tell me they've heard, often from a friend or on the internet, that inserting garlic into the vagina can treat a yeast infection. I understand why this idea has persisted. Garlic has been used in folk medicine for centuries. In some historical text from ancient Greece and Egypt, it was described as a remedy for coughs, digestive troubles, and even infection. Modern laboratory research has shown that garlic contains a compound called allicin, which does have some antibacterial and antifungal activity when tested in controlled conditions. But here's where the story takes a wrong turn. What works in a laboratory petri dish does not necessarily work the same way inside the human body, especially in a sensitive area like the vagina. To date, there are no well-designed clinical trials showing that inserting garlic can safely or effectively treat yeast infection. The few studies that exist are small, lack proper control groups, and don't follow participants long enough to see real outcomes. In other words, the evidence is not strong enough to recommend it. Beyond the lack of proof, there's also the risk of harm. Garlic grows in the ground, which means it can carry dirt and bacteria even after peeling. Placing it inside the vagina can cause irritation, small abrasions, and an inflammatory reaction that feels very similar to, or worse than, the infection you were trying to treat in the first place. I remember one patient, Elena, who is 71 and a retired school teacher. She had read about using garlic on a health blog, and decided to give it a try one evening when she noticed itching and irritation. By the next morning, she told me, the burning was so intense she could hardly sit comfortably. It turned out she had both a yeast infection and a contact irritation from the garlic itself. Once we treated her properly, she felt better within days, but the experience left her frustrated that she had tried something that caused more pain. So while garlic has its rightful place in your kitchen, perhaps in a favorite pasta dish, it does not belong in your vagina. If you suspect a yeast infection, the safest step is to get an accurate diagnosis and use treatments that have been proven to work. Your comfort and your health are too important to leave to chance or rumor. Now let's turn to the fifth and final item on our list. One that often surprises people because it's a food associated with good bacteria. That's right, yogurt. Yogurt is often thought of as a health food, and for good reason. It's a good source of calcium, protein, and in many varieties it contains live cultures of beneficial bacteria. Because of this, You may have heard the suggestion that putting yogurt directly into the vagina can help treat a yeast infection or restore healthy balance. The reasoning goes like this. If yogurt contains good bacteria, and your vaginal health depends on good bacteria, then introducing yogurt might help. It's an idea that seems logical on the surface, but the reality is much more complicated. For one, not all yogurts contain the same strains of bacteria that are naturally present in a healthy vagina. The beneficial vaginal bacteria are most often from the Lactobacillus crispatus and Lactobacillus jenseniana. Many commercial yogurts contain other strains entirely, which means they may not have any effect at all on the vaginal ecosystem. Secondly, the studies that have looked at intravaginal yogurt use have been small, inconsistent, and not particularly rigorous. Some have shown no benefit over placebo, and others have relied on self-reported improvement without laboratory confirmation. In medical research, that's not enough to recommend a treatment. And then there's the issue of safety and comfort. Yogurt is a dairy product, and placing it inside the body can cause unintended irritation. The sugar in many yogurts can actually feed yeast, making symptoms worse instead of better. Even unsweetened yogurt can introduce moisture and proteins that don't belong in the vaginal environment, encouraging the growth of bacteria or yeast. One of my patients, Denise, who is 69, and an avid gardener, once told me she had tried the yogurt remedy, because a neighbor swore by it. She admitted she felt a little silly, but after 2 nights of applying yogurt internally, her itching and discharge worsened. When we tested her, she had both an overgrowth of yeast and a mild bacterial imbalance, meaning her good bacteria had been disrupted as well. It took 2 weeks of proper treatment for her to feel back to normal. If you enjoy yogurt, please keep it as part of your diet, not your intimate care. Eating yogurt as part of a balanced diet can contribute to digestive health, which in turn supports the immune system that also helps protect vaginal health. But applying it directly inside the vagina is simply not backed by science, and can do more harm than good. Now that we've gone through all 5 items, douches, yoni pearls, sea sponges, garlic and yogurt, I want to take a moment to wrap this up with a few important reminders. We've talked about 5 things you may have come across in recent years, maybe in an online article, a social media video, a magazine feature, or from a well-meaning friend. They might sound harmless, clever, or even natural, but the truth is that each of them carries real risks for your vaginal health. Douches, yoni pearls, sea sponges, garlic and yogurt, they're promoted with promises of cleansing, balancing or healing. But none of these claims are supported by strong medical evidence, and some of these items can actually cause irritation, infection, or delay the treatment you truly need. I want you to remember that your vagina is designed to care for it's a delicate, balanced system with its own natural defenses. The more we interfere with that balance using unproven remedies, the more we open the door to problems. If you've been curious about one of these trends or even tried one before, please know there's no reason to feel embarrassed. Every day, women of all ages are exposed to health advice that isn't rooted in good science. My role, whether we've met in person or you're joining me here from your living room, is to help you separate fact from fiction, so you can make decisions with confidence. If this conversation has been helpful, I'd love for you to subscribe so you won't miss our next gentle, evidence-based discussion about women's health. And if you feel comfortable, share in the comments which of these 5 items surprised you most, or whether you've seen them being promoted online. Your story could help another woman think twice before trying something that might harm her. Together, we can create a space where women support one another with kindness, accurate information, and respect. Until next time, take care of yourself, and remember, your body deserves proven care, not risky experiment.